Yeah, so let's just start. In the meantime, Mr. Soni is joining. So
I have to move to another area, so I will join back in 3 to 4 minutes. Okay. So
okay, yeah, sure. So 1 second, yeah. So, let me start. Actually, I thought ki maybe he's joining, but Shailenji, be here. I know that election counting is there and you have a lot of work, so we will invite you first. Yeah, yeah. So, welcome, students. First of all, I would like to welcome on behalf of Amity University all the very esteemed guests, those who have given their kind consent for this panel discussion or webinar on National No Smoking Day. We all know that tobacco, smoking, and these things are somehow are well aware that they should not be consumed, used by anyone, not only youth. But definitely, this program is one step towards awareness on the tobacco use and their about their addiction and about their prevention and so on. This program is being planned as per the directives of the UGC Grant Commission, University Grant Commission, and every year nationally on second Wednesday, this National No Tobacco Day is being celebrated. We all know that tobacco use is the one of the single largest cause of preventable deaths and illness worldwide, and it kills half of its users prematurely and mostly in their most reproductive age. Tobacco use is a major risk factor for cancer also, diabetes, chronic lung disease, and many more. The experts are here, they will elaborate more. And as far as concerned with the healthy and well-being campuses, definitely this session is very important because as an educational institution, Amity University always gives importance to the well-being of the students and following all the norms. So we are tobacco-free educational institution. There is no confusion in that. But definitely, what are the things which needs to be discussed to prevent, and if any student come into that exposure, then what should be done, and what are the new policies, programs, and what NGOs are doing, what government is doing. Shri Shailenji is here. He is a nodal officer for the Gautam Budh Nagar National Tobacco Control Program, and we are very much thankful to him that we can understand tomorrow is a counting day and a lot of responsibilities are there because it's a great day tomorrow. So without wasting time, and I just want to tell students that Shri Shailenji is a very academic person. I have seen his profile. So he's he is currently serving as District Social Welfare Officer, Gautam Budh Nagar. He is also PhD in numismatics PG in archaeology, research fellow in NSI. He's also JRF in archaeology, and and Indian history and agriculture. He is former head of Mahendra Institute of Banking and Life and Motivator. So he is like has a lot of feathers in his cap, and currently he's serving in this social welfare field, and he's also the nodal officer for this. So I think he's very relevant. So I will request Shri Shailen Bahadur Singh ji to please share your thoughts with the student participants here, and just throw light on what initiatives are taken by your department or anything which you people are doing, or how students can take benefit out of that. So over to you, Shailen ji.
many thanks प्रशांत चौहान जी। सभी बच्चों का बहुत बहुत स्वागत है। क्या मैं हिंदी में अपनी बात रख सकता हूँ?
हाँ, आप कर सकते हैं, नो इश्यूज जी।
आप लगातार इंग्लिश में बोले तो मुझे लगा कि मैं अपनी मातृभाषा में अपनी बात कहूंगा तो ज्यादा अच्छे से कह पाऊंगा।
नहीं ठीक है, व्हाटएवर कंफर्ट्स यू, या नो इश्यूज।
मुझे लगता है कि बहुत सारे बच्चे ऐसे भी होंगे जो शायद हिंदी को ठीक से ना समझ पाए, लेकिन मेरी इच्छा है कि हमारे
आप जी
अपने देश के बच्चे हिंदी में कही गई बात को एटलीस्ट समझे तो जरूर, भले ही उसको इम्प्लीमेंट ना करें, लेकिन हमें अपनी मातृभाषा समझना जरूर है। मैं माननीय प्रधानमंत्री जी के एक बहुत ही शार्प नोट से शुरू करना चाहूंगा अपने इस वेबिनार को, कि आज मैं सुबह उनको सुन रहा था तो न्यू एजुकेशन पॉलिसी जो हमारी इंट्रोड्यूस हुई है, जो हमारे पूरे देश में लगने जा रही है, लागू होने, उनका ये सबमिशन था कि जो बच्चे होते हैं उनको उनकी प्रारंभिक शिक्षा उनकी मातृभाषा में ही दी जाए, जो उनकी मदर टंग है, जिस टंग को वो अच्छे से समझ सकते हैं, बोल सकते हैं, उनको उसी भाषा में पढ़ाया जाए। तो मेरा ये रहा है कि मैं एक हिंदी बेल्ट से आता हूँ, लखनऊ का रहने वाला हूँ, तो वहाँ पे हिंदी और उर्दू मिक्स लैंग्वेज है, तो हम अपनी बात हिंदी में ही कहेंगे। जैसा कि आपने बताया कि पढ़ाई लिखाई से थोड़ा सा वास्ता हमारा ज़्यादा रहा है, और सर मैं जिस जियोग्राफिकल बेल्ट से आता हूँ, बैसवाड़ा है वो रायबरेली के पास, वहाँ पर दो ही चीज़ें पाई जाती हैं, या तो आप हमसे अच्छे से पढ़ाई करा लीजिए या लड़ाई करा लीजिए। मुगलों को ना तो कभी हम लोगों ने जजिया दी और ना ही अंग्रेजों को लगान दिया। बैसवाड़े के बारे में फेमस है कि कोई भी हमसे लगान और जजिया नहीं वसूल पाया, हम लोग बहुत ही लड़ने भिड़ने वाली कौम रहे हैं। जहाँ तक नशे की बात है, जहाँ तक स्मोकिंग की बात है, भारत सरकार के द्वारा नशा मुक्त भारत अभियान चलाया जा रहा है। वर्ष 2019-20 में ये ऑल ओवर इंडिया लागू किया गया था, और टोटल 217 ऐसे डिस्ट्रिक्ट्स हैं जो आइडेंटिफाई किए गए थे कि यहाँ पर जो नशे की हैबिट है वो युवाओं में ज्यादा है। उनमें से अपना गौतम बुद्ध नगर था, और ये बहुत ही लज्जा की ही बात, मैं तो कहूँगा बहुत गर्व की बात नहीं है कि भारत के 217 जिलों में एक जनपद हमारा भी है जहाँ पर नशे की लत युवाओं में ज्यादा है। और इसके लिए हम युवाओं को कतई दोष नहीं देंगे। उन्हें जो दिखाया जाता है, उन्हें जो बताया जाता है, जो वो अपने सामने देखते हैं, उसी को इमिटेट करने की कोशिश करते हैं। सबसे पहले मैं जो रिक्वेस्ट करना चाहूँगा जितने भी पार्टिसिपेंट्स हैं और जो मुझसे सीनियर लोग बैठे हैं, कि हमें सबसे पहले अपने बच्चों के ब्रेन में जाकर ये देखना है कि उनके अंदर क्या चल रहा है। हमें कुछ नैरेटिव्स सेट कर दिए गए थे हमारे समाज के लिए, उन्हीं नैरेटिव्स को हम सब फॉलो कर रहे थे। और जो हमारे आइडियल्स हैं, मैं तो बचपन में जब बड़ा हुआ तो दम मारो दम टाइप के गाने बहुत चलते थे, और पता नहीं कितने फिल्मी गाने नशे को प्रमोट करने के लिए जो है वो बनाए जाते थे। बच्चा जो देखेगा वही सोचेगा और उसको इमिटेट करने की कोशिश करेगा। बच्चों को नहीं पता, बच्चों में इतनी समझ नहीं है कि वो जान सकें कि उनके लिए क्या अच्छा है और क्या बुरा है। बच्चों के दिमाग में हम सब प्रेशर क्रिएट करते हैं, और उस प्रेशर को एडजस्ट करने के लिए, उससे ओवरकम होने के लिए हमारे बच्चे नशे का सहारा लेते हैं। कुछ दोस्तों की संगत में, कुछ समाज के प्रभाव से, और कुछ परिवार के प्रेशर की वजह से। हमारा प्रयास ये होना चाहिए कि हम बच्चों को जीने के लिए एक स्वच्छ वातावरण दें, और उनके दिमाग में किसी ऐसी चीज को एंट्री ना करने दें जिससे वो नशे की तरफ जाएं। नैरेटिव्स बहुत गलत सेट हुए हमारी सोसाइटी में, उन नैरेटिव्स से हमें अपने यंग जनरेशन को निकाल के बाहर लाना है। मैं जितने भी मेरे सीनियर्स यहाँ बैठे हुए और सुन रहे हैं उन सबसे रिक्वेस्ट है कि हम बच्चों के थॉट्स पे काम करना शुरू करें, उनके आइडियाज पे काम करना शुरू करें, उनकी आइडियोलॉजी पे काम करना शुरू करें। हम उन्हें बताएं कि आप इस धरती पर सबसे यूनिक क्रिएचर हो गॉड के। द गॉड इज पार एक्सीलेंस। सभी को पता है कि भगवान जो होता है वो एक्सीलेंस से भी परे होता है। सो द क्रिएशन ऑफ गॉड कैन नॉट बिलो द एक्सीलेंट। जो उसका क्रिएशन है वो एक्सीलेंट से नीचे नहीं हो सकता है, और हम सब एक्सीलेंट हैं। हर बच्चे में कोई ना कोई यूनिक हैबिट होती है, कोई ना कोई यूनिक चीज होती है, हमें उस पर काम करके उसको डेवलप करना है। ये नॉलेज पार्क का जो एरिया है ग्रेटर नोएडा में जहाँ पे हम बैठे हैं, हम जब आए थे तो हमें बताया गया था कि सर शाम के वक्त यहाँ का वातावरण बहुत ज़्यादा अच्छा नहीं होता। मेडिकल डिपार्टमेंट में टोबैको कंट्रोल कमेटी है, मैंने उनसे बात करके जो भी खोमचे वाले होते हैं, पान की दुकान वाले होते हैं, उनको वहाँ से हटवाया और बच्चों के बीच में एक अवेयरनेस कैंपेन चलाई जो पिछले 1 साल से चल रही है। नशा मुक्त भारत अभियान के तहत हम कॉलेज कॉलेज जाके बच्चों को नशे से होने वाली बीमारियों, उनसे होने वाली दुश्वारियों के प्रति अवेयर करते हैं और उनको इस आदत से दूर रखने की कोशिश की हमने। पिछले 1 साल से हमारा प्रोग्राम चल रहा है और अगस्त 2023 तक हमें नशा मुक्त भारत अभियान के तहत इस जनपद को नशा मुक्त करने की कोशिश करनी है। नशा हमारे साथ खिलवाड़ कैसे करता है, इसके सोशल इम्पैक्ट्स क्या होते हैं, ये हमारे कैरियर को कैसे डिस्ट्रॉय करता है। नॉर्मली हमारे दिमाग में सर, ऑल द रिस्पेक्टेड सर, ये भरा गया कि नशा करने के बाद नींद नहीं आती और पढ़ाई ज्यादा अच्छे से होती है, हमारा कंसंट्रेशन डेवलप होता है। हम सुर्ती खा लेंगे, हम गुटखा खा लेंगे, हम सिगरेट पी लेंगे तो हमारा मस्तिष्क थोड़ा सा अवेयर हो जाएगा और हम अटेंटिव रहेंगे और इससे हमारी पढ़ाई अच्छी होगी। ये भी एक गलत नैरेटिव विद्यार्थियों के बीच में सेट किया गया, इससे हमारे छात्रों को ओवरकम होना है। डॉक्टर श्वेता बैठी हुई थी, वो टोबैको कंट्रोल की ऑफिसर है यहाँ डिस्ट्रिक्ट में। उन्होंने बताया कि जो डोपामाइन का लेवल होता है वो सिगरेट पीने से या कोई नशा करने से एक साथ बहुत हाई लेवल पर पहुंच जाता है और हम अपने आप को बहुत ही ऊर्जावान महसूस करते हैं। लेकिन जैसे जैसे उस सिगरेट का नशा उतरता है वो हमारे डोपामाइन का लेवल गिरता जाता है। तो नशा मानसिक विकृतियों के रूप में सामने आता है, सोशल इविल्स के रूप में सामने आता है, और जो सोशल डिसऑर्गेनाइजेशन होते हैं, जो सामाजिक विघटन होता है, उसका भी एक बहुत बड़ा कारण ये नशा ही होता है। मैं दूसरे के एग्जाम्पल नहीं लूंगा, मैं एज एग्जाम्पल खुद को ही रखता हूँ। मैं अपने पिताजी का बहुत सम्मान करता हूँ और मेरे ख्याल से वो दुनिया के सबसे अच्छे पिताजी होंगे, बट लिकर को लेके हमारा और उनका हमेशा 36 का आंकड़ा रहता था। रोज हमारी उनकी लड़ाई होती थी। मैं उनको पीने के लिए, भाई बाप हैं, मैं लड़ तो नहीं सकता बट कह सकता हूं, तो मैंने हमेशा उनसे कहा कि पापा ये नशा गलत चीज होती है, आप इसको छोड़ दीजिए। और अल्टीमेटली 25-30 साल बाद उनसे झगड़ा करने के बाद पिछले 6 महीने से सर उन्होंने नशे को हाथ नहीं लगाया। मैंने उनसे रिक्वेस्ट की, पापा मैं एक जनपद में जो नशा मुक्त भारत अभियान है मैं उसका ब्रांड एम्बेसडर हूं, अगर मैं अपने पिता को नशा करना नहीं छुड़वा सकता तो मैं दूसरे को कैसे छुड़वाऊंगा। मेरे पिताजी को मेरी बात लगी और थैंक्स टू गॉड पिछले 6 महीने से उन्होंने शराब को हाथ भी नहीं लगाया। वो स्वस्थ हैं और कुशल से हैं, हमारे लिए यही बहुत अच्छी बात है। तो सर जब मैं अपने बाप का नशा छुड़वा सकता हूं, बहुत ही टफ माना जाता है हमारे हिंदुस्तान समाज में कि हम अपने बाप को सही कर सकें, बट उन्होंने मेरे कहने से नशा करना बंद कर दिया। तो मुझे लगा कि जब मेरे पिताजी छोड़ सकते हैं इस एट द एज ऑफ 82, तो फिर नशा तो कोई भी छोड़ सकता है। नशा सर आकर सीधे हमारे दिमाग पे अटैक करता है, हमारे सोचने की क्षमता को प्रभावित करता है। और जैसा कि आप सभी जानते हैं, विद्वान लोग यहाँ बैठे हुए हैं, नशे में किया गया कोई भी काम कभी सही हो ही नहीं सकता क्योंकि आपका मस्तिष्क सही स्थिति में था ही नहीं। नॉर्मली ये माना जाता है, आप सब जानते होंगे कि कोई आदमी नशे में होता है तो उससे कोई भी काम के लिए हाँ करवा लेना बड़ा आसान होता है। और लोग कहते हैं कि नशे में लोग सच बोलते हैं, ऐसा नहीं है। नशे में चूंकि आपके दिमाग पर से, आपके नर्वस सिस्टम से आपका कंट्रोल हट जाता है, आपको पता ही नहीं आप क्या बोल रहे हो, तो जो आपके दिमाग में आता है वो आप बोलते रहते हैं। इससे आपका इकोनॉमिक लॉस होता है, इससे आपका सोशल लॉस होता है, इससे आपकी फैमिली डिस्ट्रॉय होती है, इससे आपका कैरियर डिस्ट्रॉय होता है, और सबसे बड़ी बात जो सोशल स्टेटस होता है, सर मेरे पिताजी पॉलिटिशियन रहे हैं, काफी हाई सोशल स्टेटस उन्होंने अचीव किए थे, लेकिन इसी शराब की वजह से उनका सोशल स्टेटस कहां से कहां पहुंचा उसका इकलौता गवाह मैं था। और मैं आपको ये बात बताना चाहता हूं कि 35 साल के बाद उन्होंने इस साल एक चुनाव लड़ा, और आपको ये जान के आश्चर्य होगा कि उस चुनाव में किसी ने उनके खिलाफ पर्चा ही नहीं खरीदा। वो इस सोशल स्टेटस को लेके चलते थे, निर्विरोध निर्वाचित हुए। सबको आश्चर्य हुआ कि 82 साल की उम्र में निर्विरोध निर्वाचन बहुत ही टफ होता है। एक चीज जो उनकी जिंदगी में खराब थी वो थी शराब। शराब को जैसे ही उन्होंने छोड़ा, उन्हें अपना पुराना स्टेटस फिर से गेन करने में समय नहीं लगा। हम माँ बाप की नजरों में गिर जाते हैं, हम परिवार की नजरों में गिर जाते हैं, हम समाज की नजरों में गिर जाते हैं, और हम कोशिश करके भी उस एक जो विस्किस होता है बाहर नहीं निकल पाते। आपको शायद नहीं पता कि जो हमारे बच्चे यूक्रेन से वापस आ रहे हैं, मैं लगातार उनको देखता रहता हूं। जो देश हमारे देश के दुश्मन हैं, पसंद नहीं करते हमारे देश को, उस देश के लोग भी कह रहे हैं कि इस समय सबसे स्ट्रॉन्ग लीडरशिप आपके देश की है। आपके देश का बहाना बना के आसपास के देशों के बच्चे भी यूक्रेन से निकल के बाहर आ रहे हैं। सर देश की मजबूती हमारे युवाओं पे डिपेंड करती है। हमारे युवाओं को इस स्मोकिंग और इस नशे की लत से बाहर लाना हम लोग का मेन मोटिव होना चाहिए, और हम सबको एक क्रिएटिव पार्टिसिपेशन से अपने बच्चों को, पूरी दुनिया का सबसे फर्टाइल ब्रेन सर हिंदुस्तान में है। आप वर्ल्ड की टॉप कंपनियां देख लीजिए, उन सबके सीईओ और सबके हेड जो हैं भारत से बैठे हुए हैं। और मुझे याद है बराक ओबामा साहब एक कॉन्फ्रेंस में बोल रहे थे, मैं उस कॉन्फ्रेंस को कोट करना चाहूंगा कि अमेरिकन स्टूडेंट्स प्लीज स्टार्ट टू रीडिंग बुक्स, किताबें पढ़ना शुरू कीजिए, नहीं तो आप हिंदुस्तानियों से बहुत पीछे रह जाएंगे। ऐसा उन्होंने क्यों कहा, और उनके इस कोटेशन को हमने यहाँ कोट क्यों किया? हमारे बच्चों को भी मोबाइल और इंटरनेट से पढ़ने की लत पड़ रही है। सर जो नशा होता है ना, जो एडिक्शन होता है, जो ये स्मोकिंग होती है, वो हमारी लत ही होती है। मैं नहीं कह रहा हूं कि थोड़ी थोड़ी कोई भी चीज अच्छी होती है, लेकिन किसी भी चीज की अति बहुत बुरी होती है। और जो ये मोबाइल एडिक्शन हमारी जनरेशन में आ रहा है, अमेरिका सर उस चीज से लगभग, जो ब्रेन है वहां का, लगभग तबाह होने के कगार पे पहुंच गया है। तो हमारे बच्चों को नशे की लत से भी दूर रखना है और मोबाइल के एडिक्शन से भी दूर रखना है। जितने भी बड़े लोग आज इस वेबिनार में बैठे हुए हैं, हमको बच्चों के सामने एक एग्जाम्पल सेट करना होता है। सर बचपन से मेरी हैबिट है कि अगर कोई काम मैं खुद करता हूं तो उस काम को करने से मैं सामने वाले को रोक नहीं सकता। पहले हमें नशा छोड़ना होगा। मैं जाता हूं, डाइस पे खड़ा होता हूं तो मैं कहता हूं देखो मैं कोई नशा नहीं करता। सर अपने जीवन में भी जिंदगी के सिवा और कोई नशा है नहीं मेरे पास। मेरे पिताजी का जो नशे का कुप्रभाव था मैंने अपने परिवार पर देखा था, तो इस लत से दूर रहना ही मैंने मुनासिब समझा। और मेरे साथ जितने भी लोग हैं, चाहे वो मेरा ड्राइवर हो, चाहे मेरा स्टाफ हो, मेरे सबको पता है कि सर को ये चीज़ पसंद नहीं है, तो हमारा ऑफिस तो सर नो टोबैको ऑफिस ही है। हम जहाँ जहाँ जाते हैं प्रयास करते हैं कि वहाँ पे लोग नशे की लत से दूर रहें। आप सब जितने भी लोग यहाँ बैठे हैं, जितने भी छात्र इस वेबिनार में पार्टिसिपेट कर रहे हैं, मैं आप सब से रिक्वेस्ट करना चाहता हूँ, ये जिंदगी बहुत अमूल्य है। तुलसीदास ने लिखा है रामचरितमानस में, बड़े भाग्य मानुष तन पावा, मिटे दोष दुख दारिद्र दावा। ये मनुष्य का शरीर है जो बहुत भाग्य से मिलता है, हमें इसको डिस्ट्रॉय नहीं करना चाहिए। हमें इसका जितना मैक्सिमम आउटपुट सोसाइटी, अपनी फैमिली, अपने हित में दे सकते हैं। सर मैं जब भी कहीं जाता हूं तो मैं हाई स्कूल इंटर के बच्चों से सिर्फ 4 साल मांगता हूं। आपकी जिंदगी के ये जो 4 साल हैं, आप सिर्फ ये हमको दे दीजिए, बाकी आपके अगले 40 साल में इतने आराम से बिताऊंगा कि आपको एहसास भी नहीं होगा। बच्चों के पास अब 2 ही ऑप्शन है। मैं थोड़ा सा सर क्रिएटिव हूं, तो एक क्रिएटिविटी मैंने बच्चों को अक्सर बताई है। बच्चे जब कभी पूछते हैं कि सर सफलता कैसे पाई जा सकती है, तो सर मेरा एक बहुत ही सेट फार्मूला है कि सफल होने के लिए आपको सिर्फ एक फार्मूले पे काम करना है, दैट इज योर एफर्ट प्लस फेल्योर इक्वल टू सक्सेस। जितना बड़ा एफर्ट होगा उतनी बड़ी फेल्योर होगी, उतना बड़ा सक्सेस होगा। जिंदगी में जो आदमी असफल नहीं होता सर, उसे सफलता का स्वाद कभी नहीं मिलता। जो छोटी छोटी असफलताएं होती हैं वो इंसान को हमेशा बड़ा बनाती हैं। तो जितने भी छात्र छात्राएं इस सेमिनार में हैं, इसको ज्वाइन कर रहे हैं, उनसे हमारा रिक्वेस्ट है कि आपके जीवन का जो गोल्डन पीरियड है वो आप एमिटी यूनिवर्सिटी में जी रहे हो, और इस पीरियड को अपने हित में, अपने फ्यूचर के हित में आप जितना बेहतरीन तरीके से आग में तपाओगे, आपकी जिंदगी उतना ही बेहतरीन निकल के बाहर आएगी। मैं जिला समाज कल्याण अधिकारी, नोडल ऑफिसर इस जनपद में नशा मुक्त भारत अभियान का, जब भी किसी छात्र को, किसी भी व्यक्ति को इस समस्या के बारे से निजात पानी हो, इस समस्या से बाहर निकलना हो, सर वो सीधे हमारे पास आ सकता है। भारत सरकार की एक स्कीम है कि अपने जनपद में एक एंटी डी एडिक्शन सेंटर खुलने जा रहा है। इसका प्रस्ताव गवर्नमेंट ऑफ इंडिया को जा चुका है। जो लोग नशे के आदी हैं उनके लिए यहाँ पे रिहेबिलिटेशन प्रोग्राम होगा, और जितने भी लोग उससे जो चाहते हैं हम उन सबको जोड़ेंगे। और सर जैसा कि मुझे इशारा किया जा रहा है कि मेरी चुनाव की मीटिंग शुरू होने वाली है, तो मैं आप सबसे क्षमा चाहते हुए कि चूंकि काउंटिंग के ठीक एक दिन पहले ये वेबिनार रख दी गई, तो मेरे पास समय बहुत कम है। मैं आप सबसे रिक्वेस्ट करूंगा कि आप सब लोग इसको कंटिन्यू रखें, और जिसको भी कभी भी चौहान साहब जरूरत पड़े हमारी सेवाओं की, हम अवेलेबल हैं। प्लीज आप हमें कांटेक्ट जरूर कीजिएगा। बहुत बहुत धन्यवाद।
बहुत 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 धन्यवाद, आपने इतना समय दिया, क्योंकि आई नो कि कल वोटिंग है और कल बहुत बड़ा दिन है उत्तर प्रदेश और जहां जहां चुनाव हुए हैं, एंड यू आर वन ऑफ द की पर्सन इन दैट, सो थैंक यू सो मच। एंड आई होप योर थॉट्स, वट एवर यू शेयर्ड योर एक्सपीरियंसेस एंड एज ए इनिशिएटिव्स व्हाट यू आर प्लानिंग टू डू, जो भी आप करने जा रहे हैं, तो हम लोग आपके साथ हैं। हमारे बीच में पब्लिक हेल्थ डिपार्टमेंट के, एक सेकंड शैलेश जी, डायरेक्टर अमरीश चंद्रा जी भी हैं, तो मैं उनसे रिक्वेस्ट करूंगा कि 1 मिनट आप थोड़ा सा वेलकम बीच में कर दें, क्योंकि शुरू में कुछ एक प्रोग्राम और चल रहा था, सो ही वाज नॉट हियर। जी
सर, आपका बहुत बहुत स्वागत है, और मेरी तरफ से आपका स्वागत है इस वेबिनार में। और मुझे मतलब क्षमा ही मांगनी पड़ेगी कि आपको सुनने का
कोई ऐसी बात
नहीं पाएगा।
नहीं शैलेश जी, आप आए, हमें अच्छा लगा। कभी फुर्सत से जरूर आपको दोबारा सुनने की इच्छा रखते हैं।
मैं आऊंगा सर, जरूर।
स्पेशली एक अलग से आपसे टाइम लेकर के बिल्कुल आपसे एक अच्छा इवेंट कराएंगे, आपको बुला करके।
मैं जरूर आऊंगा सर, जरूर आऊंगा सर। थैंक यू सर, थैंक यू सो मच।
शैलेश जी बहुत बहुत धन्यवाद, थैंक यू सो मच
सर। ऑल प्लेजर ऑफ माय साइड सर। थैंक यू सो मच।
थैंक यू सो मच।
ठीक, नमस्कार सर।
जी, thank you. And in this now I think Amrish ji, you can just speak some welcome address, because Dr. Abhishek and Sunil ji is here.
Yeah, thank you sir. हम लोग की एक दूसरी कॉन्फ्रेंस चल रही थी, so we got a little late. So I welcome each and everyone over here. And basically when we talk of smoking, so smoking in all forms of tobacco use are a major public health issues. So tobacco use and dependence is the world's single biggest cause of preventable death and non-communicable diseases. And it is surprising to see that up to half of all the smokers die from tobacco-related illness, such as cancer, lung disease, or heart disease. And a very big number, like approximately 8 million people each year die because of this, as per the WHO estimates. जब हम ग्लोबली बात करते हैं तो ग्लोबली अराउंड 942 मिलियन मेन एंड 175 मिलियन women aged 15 and above who are currently smokers, with particularly high prevalence in Asia region. So Asia region is one of the biggest regions which have this smoking. We also see this trend a lot in Western countries also. Today we have gathered here for an enriching webinar panel discussion to sensitize the youth community on issues around smoking. The theme for discussion today is today on non-smoking day, no smoking day, which is observed on the second Wednesday of March every year, is tobacco smoking addiction from prevention to treatment. And no smoking day is not only about encouraging people to quit smoking for 1 day or 1 week. It is basically an opportunity to get people to think about living a smoke-free life. So quitting smoking and all this tobacco-related products for lifelong. That is what basically we encourage people to do. And this also includes, when we talk of tobacco, we also talk of smokeless products like gutka, and we also talk about e-cigarettes, which have their own health hazards. So there are many people who think that e-cigarettes are safe, but actually they are not. And this webinar will greatly increase the knowledge of issues around smoking, nicotine dependence, and the types of substances used, with a view to treatment and prevention of the smoking behavior in young people. And to carry forward this discussion, we have with us eminent speakers, Dr. Abhishek Shankar ji. He is an MD, Associate Professor, Department of Radiology Oncology in AIMS. Shri Shalendra Bahadur Singh ji, we just heard him, District Social Welfare Officer and Nodal Officer, National Tobacco Control Program, Gautam Budh Nagar. We also have with us Shri Atul Soni ji, District Probationary Officer, Gautam Budh Nagar, and Shri Sunil Vatsen ji, who is the founder and president of NADA India NGO. Each one of the experts, the speakers are expert in their domain, and we hope that the audience will participate and interact with the speakers to gain the most out of the deliberations. And with this, I hand over the program to Prashant Chauhan sir, who is the coordinator of the event.
Thank you so much, Dr. Amrish. So, I know that everyone is busy, and I can understand Dr. Abhishek is in AIMS, and I am, and in Patna AIMS is there to, initially set up and everything, and he's looking after. So, I just want to say that this webinar is very important in many ways, because already many speakers discussed about the topics, and Challenji has given a lot of information about what he is doing in Noida especially. And now I'm moving to technical expert, for today. He's a great personality, and I just want to read what he is now. So Dr. Abhishek is currently serving in AIMS as associate professor in Department of Radiation and Oncology, and he is the associate editor of Asia Pacific Journal of Cancer Prevention. He is associate editor of South Asian Journal of Cancer. He is editor in chief of Asian Pacific Journal of Cancer Care. He is founder secretary of Indian Society of Clinical Oncology. He is member of Tobacco Control and Smoking Cessation and lead membership working group, International Association for the Study of Lung Cancer. So he is MD, and he worked at AIMS from 2012 to 2019 in Delhi AIMS, and now currently he is in Patna. He worked in different capacities, from resident doctor to research fellow and faculty. He is a NCI Cancer Prevention Fellow also, and recipient of many national and international awards. He is a member and chair of many national and international committees. His research areas are clinical and research interests include community-based cancer prevention, quality of life issues of cancer patients, cancer screening, global oncology, cancer policy, cancer management in resource-limited settings, tobacco control and smoking cessation, and familiar and high-risk cancers. So you can see that he has done tremendous work in this field, and he's the right person, students, for all of you to understand the pros and cons of this on this National No Smoking Day. So without wasting time, I would like to invite Abhishek ji, Dr. Abhishek, on the panel, so that he can just share his thoughts. And sir, you have time.
Yes, so thank you so much, organizing committee, for this opportunity. So, tobacco is a subject which is close to everyone, because I think no one in this society who has not seen either they are using it or they have seen the adverse effect of it. Being a cancer specialist, it's become more important when I talk about 30 to 40% of cancer cases are attributed to tobacco. And in view of like geographical location, if you see, like Sir said about Noida in Delhi, and it's so much of geographical variation in the tobacco uses, and we have different form of tobacco, but yes, none of the tobacco form has been found to be useful for health, human health. So this is, but there are many controversies, and especially from many of the times our politician ask, where is the evidence where we can see that there is a harmful effects of tobacco on cancer or any other illnesses. So this is and I personally think whatever we should have done for the tobacco control in this country, nothing has been done so far, because a single tobacco, because we are so much worried about COVID-19 right now, which is killing people, almost more than 5.5 million people here in India. But tobacco kills almost 1.7 million people, around 17 lakhs people in India every year. Do we have any concern over it? And have anyone in out of the 60 people attend this seminar has seen any agitation, any protest against tobacco, because this is killing so many patients in India every year? There is no such protest. So probably this is a addressal to the student. They are the future of any country. India has more of young people, so I think future lies with them, and they are the one who is going to use it. Either many of the people are still using tobacco, and many of the people might acquire this habit from their batchmates or from seniors, and during their process of learning in many of the universities. So this is an important agenda to set. And for tobacco causes, as far as cancer is concerned, I can tell that it is responsible for 13 important cancer, apart from causing many of the NCDs in terms of respiratory diseases, stroke, cardiovascular diseases. And it is basically used in various forms, like many forms. If you see the geography, go to the northeast, they use in a different form, Delhi different form. So all this form make it like India. In India, you should remember three places where currently we are number two at two places, and probably in future we might acquire that first position. First in tobacco also, China is the largest population who uses tobacco. It's around 30 crore. If you see in India, it's like 27.4%. Although we have a promising data to support us that in GATT survey, in comparison to the GATT 1, in 2, there is a decrease in tobacco uses in the 15 to 24 years of young adult, and that decrease is very significant at the amount of 33%. In GATS 1, they have seen that in age population of 50 to 24 years, 18% were smoker, using tobacco, but now it has reduced to 12.4%. It may be due to the advertisement. Many of the teachers have taken initiative at their places, many of the government initiative to make them aware, because of health seeking behavior and other important things are more to the people who are in the urban area. But I can say there is a big divide between the urban and the rural area, about the uses of tobacco, about the access to the healthcare system, and there is a big disparity science involved in the tobacco use. How to approach a health facility when you have the symptoms related to tobacco use, and ultimately this disparity and inequality is causing making the outcome different from the people who live in the rural area and who live in the urban area. So as I said, that cancer important risk factor, tobacco is the number one in India, and outside also there are more than 7,000 constituents in tobacco smoke or other parts, but yes, more than 60 are known carcinogens. Having said that, this will cause cancer for sure if you use it for the longer period of time, and there are multifactorial approach. So it's not necessary that somebody is smoking or somebody is using tobacco. It may be in 5 next years somebody will have cancer, somebody can have cancer in 20 years, but it is relative risk is very high. And various component like aldehyde, benzene, metals like chromium, polonium, nicotine, nitrosamines, polyaromatic hydrocarbons. These are the component which causes, that is a term called chemical carcinogenesis. And this is not the one organ. Many of the people who just continue to eat tobacco, and over the period of time they are cured with one, but until and unless, and if you are smoking right now or taking tobacco right now, your risk will be very high until and unless you completely stop taking it for 15 years. That only normalizes the risk to the normal individual. We just talk about two very important approach, and as far as treatment is concerned, probably the best strategy still lies with cognitive behavior therapy, because you have yourself started to to use tobacco. So the only thing you can convince yourself, you can meet a people who are good in tobacco cessation activity, and there are various stages. I think we, in scientific term, we use it pre-contemplation stage, where you don't believe that you have to quit tobacco, you just ignore it, you don't in 1 minute. हाँ मैम एक लेक्चर है मैं आ रहा हूँ yes ma'am. Okay. So I'm so sorry. There was a patient call. So in contemplation stage, this is said that yes, now you are ready, that you are thinking of quitting tobacco, which is many of the people wanted preparation phase. Many of the people are preparation phase, but they never go into action. That is next is action. That okay, you have quit tobacco. Then the cycle again comes. Then maintenance. It is very difficult to maintain any activities which is behavior related. If you maintain it, credit goes to you. And many of the people, after maintaining for a longer duration of quitting, they again relapse and come back to the same place where this thing was they were quitting. And related to the law, as I said, there is a famous law, Kodpa. I'm not in a favor of this because in India 85% tobacco is used in smokeless tobacco, which you call it the other, which is not smoking part. Even the smoking part also, only 5% is cigarette smoking, 10% is BD smoking. And what is surprisingly, what is the name of act which we follow in India about the regulation as a sport part, cigarette and other tobacco products. Can you beat it? That 95% focus you just concluded with the other tobacco products, and you start with cigarette and you end with cigarette, and this is a normal conception among all of us when we talk about tobacco. Everybody remind us for the smoking cigarettes, and when you see many of pamphlets, posters, you will find whenever they are celebrating tobacco day, only one thing is smoking, and you can just witness it in the slides which is projected by Amity University. So you are just projecting 5% of what we are doing right now. I have strongly written, and I work for Government of India, so we need to change it now, because it was started with cigarette and later on added cigarette and other tobacco products, but we need to see about it. And many of the interesting story you may not be knowing, and maximum investment of ITC lies with life insurance company, and they have an investment of out of the normal which is recommended is 15% investment, they were having an investment of 16.7%. So later on it was reduced. That's why LIC promote their ad by saying जिंदगी के साथ भी और जिंदगी के बाद भी. So whenever you are smoking cigarettes, money is going to LIC, and when you are die after smoking cigarettes for a period of time, the money is with LIC. So please, next time, this is a factual statement. You can go and check online. So you need, LIC has, I will give credit to the maker, that they made a very smart ad about decoding what they are doing right now, and they just clear cut said that yes, their investment, which is so probably you all should think about buying a LIC next time, that yes, your money is invested in Indian Tobacco Company for sure, because which is the major investment by LIC. So as I said, behavior modification is the key to success, and probably nobody has told you to start tobacco. So it's you who will change the whole thing and probably try to make things better for you. There are a strategy, like, there are 2-3 things which is very important. In India, suddenly you see there are so much of advertisement about इलायची. आपको मतलब मुझे अब इलायची खाता हूं तो मुझे लगता है कि मतलब माय गॉड, I am taking one thing which is advertised by all the Bollywood stars on television. I feel so good about it. And इलायची कभी भी इंडिया में इतना इम्पोर्टेंट नहीं था, which is called surrogate advertising. अगर आप किंगफिशर पानी बेच रहा होगा, तब भी आपके दिमाग में किंगफिशर की बियर आएगी. So this is surrogate advertising. You are just trying to make people remember your brand through the advertisement of different thing. Government of India and every government organization, what we are doing is demarketing approaches. We are using it, like हमने टैक्स बढ़ा दिया, हमने उनका प्रोडक्शन पे, मैन्युफैक्चरिंग पे रोक लगा दी, हमने कहा कि आपको सारी चीजें plain packaging. This is all demarketing strategy. But do you think that in a marketing era where companies are spending billion of dollars in advertising and making an effective marketing campaign to reach people and to make sure that all things lies in their brain. What they do is there are phases. They just get the input. The input means they use large amount of money, then coming up the activity. They design a very good program. Okay, what is liked by the youth, so they make a design and output. They over the period of time they get the output in the short term, intermediate term, and the long term. Gain in terms of how many people are picking it, and this is a habit. People's style starts with the style and they end with something which is what happens. So what is important is a counter mechanism, a marketing approach. Amitabh Bachchan started doing advertisement for a gutka brand, pan masala brand, which is it's something called, we call it, it's just organic thing, and it is uh, just developed by non-purity. But this cancer has a chronic theory. Anything which is irritating your mucosa for the longer period of time, and suddenly the growth is abnormal, that is called cancer. Your own sharp tip may cause cancer in the longer run if it is a continuous in nature. Can you believe that many of the Western countries, people are dying because of skin cancer because of the direct exposure of sun to their body? So this is a chronic theory associated with the cancer. So we need to have a counter marketing approach, because pan masala has many brand ambassadors. Can you please tell me who is the brand ambassador for cancer activity for the country and the anti-tobacco campaign for this country? Because I will be very happy to see, I have seen 007 advertising about pan masala on the first page of many of the national newspapers. But I am still will be happy to see, till the time I am alive, there is a first page ad about the anti-tobacco activities given by government, and we should have a brand ambassador. Why only one? We should have many. Like, our honorable prime minister had changed the whole concept of hygiene by inviting people to become brand ambassador for Swachh Bharat. And now you can see the result. People have started incorporating it in their day-to-day life, and this kind of activity is needed for the anti-tobacco campaign. Rahul Dravid was the brand ambassador for Ministry of Health, but probably it was not a successful model. Probably most of us have no idea who is the brand ambassador that narrates the story of your sustainability of your campaign. So our all intervention, which is short term, long term, will also have a long term sustainability, so that we can say that yes, India has gained substantial amount of success as far as tobacco cessation activities are concerned. So treatment wise, as I said, that treatment is basically targeted to the behavior. You need to modify your behavior, and if it, and somebody has already explained, it is anticholinergic, mechanism of action, dopaminergic, it releases adrenals, and the side effects are related to all this thing. So there are many alternative. Nicotine replacement therapy is one of the option, but I for personal views, it has not been successful. It's like a Chinese balm. आप कभी चाइनीज, आपको सर में दर्द हो तो आप चाइनीज बाम लगाओ, आपको चाइनीज बाम इतना ज्यादा पेन खुद देता है कि आप अपने नॉर्मल दर्द को कम मानते हो. So it's like the same. Nicotine replacement therapy, people, chances of that coming to the action to the relapse is very, very high. And whatever people in my close vicinity have gone for this kind of intervention, they have high relapse rate. So it is available in patch, gums, nasal spray, lozenges, nicotine vaccine. And as far as the therapy is concerned, they are directed towards antidepressant therapy, bupropion and nortriptyline, clonidine. It is used in the primary or the secondary treatment option, which is again, but yes, still, what is the best thing to offer to anyone who believe in getting for tobacco cessation is the cognitive behavioral therapy. That is the best one, and you should have follow the 5A and the 5R policy. 5A means you know you have to ask, advise, assess, assist, and arrange. And 5R is relevance, risk, rebound, rapidity and the roadblocks. These are the 5A and 5R principle you have to adopt. This is itself is a big seminar topic to talk on tobacco suggestion, and it is beyond, the scope of any 30 minutes or 1 minute seminar. But anyone who has adopted tobacco, and if they need some kind of guidance related to the cognitive behavioral therapy or anything related to tobacco suggestion, probably I will be very happy to serve, because I work for tobacco control, not only with the government of India, but with other important organizations globally. So this is all about brief, super brief about tobacco, in our country, and related clinical aspects. And, so there is one thing, we always talk about tobacco suggestion and general population, but I have taken this responsibility to inform and to encourage our colleague to make sure that there is a very important component of tobacco suggestion in a patient who has already diagnosed with cancer, because that has many other risk for many other cancer. And it has been said that if you just focus on tobacco suggestion in a patient who are already diagnosed with cancer, there is a, benefit in terms of overall survival and disease-free survival. But what is the main thing related to it? It requires time. If you want to make any community-based approaches, you need at least 15 to 20 years to gain your short-term objective, which is very difficult. No policymaker is having that much time. No politician, their job is just for 5 years. So we need to think about continuation of the activity, what is irrespective of the, which party is in power. And probably we have improved over the time, but there is lot many things to be done. And for the cancer activity, we focus more on giving targeted therapy, immunotherapy, because it is a, associated with the economic, outcome. So there are so much of economics involved, but the time we should give it to convince people in tobacco suggestion. What we do in our clinic, okay, आप तंबाकू खाते हैं, आगे से नहीं खाना, काम खत्म. So it is not part of our continuum of cancer care. So that we should make it. I accept this responsibility due to many other factors, but it can't be, given an excuse that we are not doing because of a blah 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 reasons. So we need to focus on this. Apart from talking about tobacco suggestion for general population, we must think about tobacco suggestion in a patient who are already diagnosed with cancer. Thank you so much, for this invitation, and this is enough for today. So this is very sensitive topic for me. I can talk for days and months on this. So but for today it's a limitation of time. So I will finish here.
Yeah, thank you so much, Dr. Abhishek. And I think very nicely and very informatively you have given all the information. And I think those who are participating in this webinar, definitely they would have learned many things. And maybe we will be in touch, and we'll request you if you can just be as an advisor to our students or in further anything as per your time limits.
If they want to do any kind of study, because ultimately it's about the data which we fail to produce. So anything they want to do, any short-term or questionnaire-based research related to tobacco or related to cancer, I will be very happy to assist them.
Yeah, we will explore this. Yeah, we can submit something and we can do some funded research also
along
with your cooperation.
So about the research methodology on tobacco, I will be happy to do that. Okay.
Yeah, thank you so much. And whenever, please, sir, come to Delhi, I will be in touch with you. Do let us know. So we'll invite you physically also.
I'm in Delhi on every weekend. So.
Acha, okay, great. I'm just asking students if there is any question with Dr. Abhishek, then I think this is the right time to ask, because he is busy, so he may have to leave for other meetings and all. Is there any other question from the students?
Yeah, please ask Viswajit.
Yeah, because he has to leave, so maybe he will not be able to hear till the end. So is there any question from any student of any kind? You can just unmute and then ask question, please.
Yeah, Viswajit, please go ahead. Please ask.
First of all, thank you so much, Dr. Shankar. That was a very informative session and everything. I just wanted to ask, we have seen that over the years, in cigarette packets, there have been showing cancer-prone lungs, and they have been promoting pictures of that. So, do you think this is a bit of an insensitive approach towards a more a population that is more prone to mental illness? Let's say, for instance, someone who is suffering from hypochondria. The person comes across a packet of a mutilated lung or a mutilated mouth, and that might negatively affect his or her psyche. So, what do you have in that
Okay.
aspect?
So this is a good question, but what is the incidence of hypochondriasis in India? So this is very less. So we make program for the larger audience, and you see the warning for every country. There are so much of variation, and if you see in the Southeast Asia, basically you will find all this kind of warning in this. If you go to New Zealand, Australia, they have a different, because they have divided the alarming sign and symptom into two parts, like 14. So in the first batch of the cigarettes, 7 will be printed, in the next batch 7 will be printed. So I am very agreeing to that, but cigarette packet is a very small size, and we should have an innovative design to hit the right mind and the heart of the people. You need to fix the context, which is very important. And with this advertisement in either in the PVR or the cinema halls or on the cigarette packet, we are talking about plain packaging, but still India has not done it. But you need an innovative one, and probably India has so much of innovation. So personally, I also feel that is not very convincing. People learn to avoid that. Okay, people learn to avoid that if it is something which is hitting their mind, because it doesn't touch, and people are not scared at all over the period of time. So, and there should be a continuous change, because you must have not seen any change for last many years on the cigarette packet photographs. It's same. So over the period of time, what we do, we learn how to adjust with those things. So there is a innovation required about this design of the cigarette pack, and probably plain packaging will help us more, where they can company people can't advertise it. It's still 85% in India. So yes, it is a bigger concern. Probably hopeful we will be able to achieve something. But it is a big lobby, and I told you, cigarette in India, cigarette is not a problem. 85, I said 95%, tobacco is used in either in form of BD or smokeless tobacco. So we are just not targeting the larger population, and then cigarette is also important to counter. But meanwhile, other 95% are important one to be countered. For that we have no strategy till we are trying, but they are not. Cigarette is highly regulated among all others tobacco products. Other tobacco products needs to be regulated in the way cigarette is being regulated. That can help us better. Hope I have answered your question.
Right, sir. That answers it all. Thank you
Thank
so
you.
much.
So it's over for the day. So I can share my email ID. If you have any question to ask, you can ask me on email. Thank you so much. I will log out because I have another work to do. Thank you so much.
Thank you
Thank you
so
so
much,
much.
Dr. Abhishek, for joining and giving your time. Thank you so much. Yeah, so moving further, we have another speaker with us, a resource person for this session. He's a renowned person. Um, he's a if you search about Sunil Vatsyan ji, so he's a great personality in many ways. He is a founder, chairperson of NADA India, and by training, he's a MSW social worker from Jamia Millia Islamia. He has, long career in development sector. He established, formed various organizations, NGOs, and in that he was one of the founding directors of the Navjyoti India Foundation, also with Dr. Kiran Bedi, and many other initiatives. So currently, and he's working on Healthy Campuses campaign. He's also the governing board member of National Association of Professional Social Workers in India, and very much active in socially, and especially for this issue, he's very relevant speaker. So I will request Sunil ji to give the perspective on this, especially to the social work student as a social worker, that what they can do, and what your NGO is doing, and what are the opportunities as a career in this sector, so students can look after, especially this tobacco and this area. Over to you, sir.
Thank you very much, Dr. Prashant ji and Public Health Department of Amity University for inviting me, for being part of this panel, and very important day, as Dr. Abhishek has informed, that it is not enough to work just for tobacco, especially for the cigarette or smoking. Smoking in general, certainly it covers BD as well as other form of e-cigarette or otherwise. If we see these risk factors, because tobacco is a risk factor for one of the major risk factor of non-communicable disease, and we have already seen a connection between the tobacco, COVID, and non-communicable disease. The COVID was or is very fatal only because of the non-communicable disease, and tobacco is one of the risk factors. So nobody can deny, as far as risk is concerned, of the tobacco in any form, whether it is smoke or smoke-free, smokeless tobacco. Cancer is something predominantly has been used for prevention, and so is there is a other disease which are being part of like non-communicable disease spectrum, whether it is a hypertension or heart disease. They are like equally, it is a risk factor. Tobacco is a risk factor. And as far as like if we see the non-communicable disease spectrum as well as the risk factors, it is a basically social condition. So that's why it is predominantly a social work domain, which directly connects, because it is all, as Dr. Abhishek Shankar ji has said, it is all behavioral, or it is all your cognition or cognitive behavior therapy is needed. So it means it need to be responded from by social workers or psychologists or sociologists or public health professionals. Otherwise, it will lose the battle, because it is not just a medical problem. Medical problem becomes once you develop the disease and it becomes full blown, and you are then you are handling it or treating it. So it means what is needed is the prevention is all about your social work interventions are needed, whether it is a casework, whether you need group work, or whether you need a community work. And certainly, social advocacy is something. Policy advocacy is needed, as far as because changing in the law, or as it has been suggested, like code by amendment or anything which needed more. NADA India is a youth-driven organization. NADA India is the main motto is to involve, engage, and empower the young people, because they are the target of the tobacco industry, or whether it is the alcohol industry or food industry, because they are encashing on their vulnerabilities because of their I will not call them that they are immature, they are children. No, it is their vulnerabilities which has been, you can say, has been targeted by the industry. If you see any of the advertisement, it is their vulnerabilities which has been they have been engaged for it. So certainly we just thought NADA India that if the consumer become, if prospect consumer become your change maker, and whoever is, I can see there are so many already social work background students as well as public health students who have been part of our NADA India interventions as well as projects as a part of their. So they have been already been involved in our different program. We have been working in at the national level as well as specifically through NADA Young India Network for Good Health. Prashant ji may recollect that we started our Healthy Campus campaign with a focus on non-communicable disease with his department of social work itself. I think 2016 or 17, where we got enthusiastic new volunteers and those who have now they are working as the leaders or champions or health advocates in different parts of India. So this tobacco is an area where when the industry is targeting young people, so we should involve the young people itself. We have been like focusing on Haryana and Himachal Pradesh and Punjab with a focus on changing the at the advocacy level as well as engaging young people and becoming health change makers, peer leaders, peer educators, and then peer health advocates also. So we certainly would like people like from Amethi, more and more young people to join us as for their internship or for any other work which they would like to work on it. There are two issues. One is because rightly said like by Dr. Abhishek, the canvas is very big where you have all kind of tobacco and but smoking is something which is not because other tobacco forms of tobacco is not affecting directly as the smoking is affecting other people also, like through passive smoking. If you see, the passive smoking is something which needs very specific attention of all the policymakers and young people. And we are not asserting our right to ask for as a consumer. We become a very secondary consumer, a least bothered consumer, especially if you see in COVID situation, the lockdown situation, if you see all the smokers who have been smoking in the public place or otherwise in open space, they last 2 years, they must be smoking within the house and how it must have been affecting the other people like children, the women. Yesterday we have observed the International Women Day and they are the prime victim of passive smoking and because they become a victim because by virtue of others are smoking. So naturally you need a smoke-free environment at home, at workplace, and in any close areas. The Kotpa Act, which has been this cigarette and other tobacco prohibition of advertisement and regulation and trade commerce production supply distribution Kotpa 2003, it talks about designated smoking area. So this was one of the relief or discount which has been given to the industry and they are misusing it severely. Like if you see if they have like most of the restaurants and hotels where they have more than 30 tables or rooms, certainly they can have this designated area, which is, and you might have seen on the airport also, this designated smoking area. And there is a total misuse of this provision. So in the we really appreciate the current government for bringing up an amendment in the new law, and they should consider this the totally banning of this because there is a misuse and people are using it for their own interest, vested interest. And we have seen families are going to the restaurants and hotel and they are not prefer any sort of restaurant where tobacco is allowed, or if there is a designated, because you can see the pilferage or the kind of smoke which comes out because you can't have a perfect system of keeping the smoke in a particular place restricted. it will come out certainly because, and you are making other people vulnerable, especially when COVID is there. And COVID, because of the COVID, close proximity of these social distance you can't maintain. So certainly this designated smoking areas become very is not needed as such. But certainly we continue to have them, and hotels associations and youth and public health researchers and professionals, they are demanding that we should ban. And I think the next parliament sessions, we can expect the Codpa amendment, which will take care of these concerns. And certainly we can see that we can work for a smoke-free world. In any sense, world means wherever you are, the space you are enjoying in your private space or in public space, where you can always say no with more assertion is needed, and you can enjoy a very because if you see the pollution condition in Delhi itself or NCR, it is worse in the last few days, but pollution is also one of the risk factors. And we need to work on these different risk factors more collectively. So I really appreciate if the students can ask questions and I can answer those questions. That will be more two-way communication I really enjoy. And people can come up with their ideas and kind of suggestions which will certainly help us and enrich our campaign, making youth for tobacco-free India. So it is the youth who is an answer, who is, I will not say youth is or child is not today, is not tomorrow. It is today, and they need to come up with their own newness. They need to come up with their creativity. They need to come with their own understanding of the subject, as well as to join any of such. I'm not saying that NADA India is only one. There are so many civil societies who have been working, and certainly we can work for a healthy campus where you can see tobacco free or making smoke free. Your own institution is one to begin with, and we really appreciate that Amity is already taking steps to making it more smoke free and tobacco free, but always there is a new batch of students who comes every year. So naturally, because this we can see that children are starting the tobacco even at the age of 10. So it means while they are coming for higher education in your institution, so they might already been exposed or been using tobacco. So naturally, the tobacco cessation program, tobacco awareness program, and your policies always helps the students to take care of themselves. And I found that it is not only an institution, but the hub which has been around, because all those tobacco aspects of products are available close to your institution. Not only Amity, I'm not talking just referring the Amity, but if you see the Delhi University also, you may not find tobacco within the university campus, but very close to in Kamla Nagar or other places close by, you will find enough. It's a hub of all kind of like whether it is a use of tobacco, alcohol, or food or junk food, whatever it is all there, because they are the people who are giving you the pleasure, may not give you the happiness. We really appreciate, and if I will appreciate if you people can ask me question, and we can interact, and we can look for some more inputs from you people also. Over to Prashant ji. NAPSI, National Association of Professional Social Workers, has already initiated in 2016 a campaign on healthy campus with NADA India Foundation. So certainly we will be happy to get associated with any institution of excellence where or higher education or schools where we can initiate and continue to work. And a new education policy is when we are going to implement. Certainly, good health is a main driver, you can say, and a driving force in the whole education system, where we can see the role of social worker and counselor a prime, and that is all with the focus on behavioral aspects of it. And risk factor is certainly is which needs a sustained efforts, not just as like rightly said by Dr. Shankar, that it needs a sustained, because it's a relapsing problem, it's a chronic problem, and it says it's a behavioral aspects is are more needed than the medical intervention. And we need more intervention or innovation in behavioral aspects. We are happy to have more students who come up with a research internship or join us on those aspects. We'll be happy to support them financially or otherwise technically, no, with knowledge base. Yeah, thank you. So we can keep it open, or like
Yeah,
as you
thank you. Thank you so much, Sunil ji. I think you are the right person in many ways, because normally the implementation and sensitization, awareness, there are many aspects which are there in terms of smoking, tobacco consumption, and even drugs and other substance abuses. So, and you are doing great work. So in this line, I believe students would have learned many things, and as Dr. Abhishek already discussed and shared that in terms of research, you all students can work, and definitely Mr. Sunil is also the right person in terms of helping in research in this area. So this is one very important aspect that you can take. So is there any question of any student? Or I'm just before moving further, so you can just raise your hand and then ask questions. Any question from any participant? Yeah, Anjali, unmute and ask, please.
Yes, sir. Very good evening, sir. First of all, thank you so much, sir, for enlightening us. And it gives me immense pleasure while saying this, that I like Amity Institute of Social Sciences has provided me this opportunity to work with Navjyoti India Foundation as well. As Prashant sir mentioned that you were the founding members, and it gives me immense pleasure while mentioning this. And so currently, I'm working with this community, Seelampur in Delhi. AISS only provided me this opportunity to work with them, and there, as you mentioned, that tobacco is targeting youth. It is taking youth into this vicious circle, and you also mentioned regarding encashing vulnerability. So I visited this community, and there were legit 10 to 12-year children smoking BD and other sort of stuff, and it was very devastating for me to ex- uh, witness that. So my question to you is, how, as a trainee social worker, should we can help these children, and what should be our first ethical step towards eradicating this?
uh, uh, the aspect of community work is very important in the field of tobacco prevention and treatment and rehabilitation. As you rightly said, because if I see all the the best and first thing and foremost thing is the youth engagement. The meaningful youth engagement is important. I have seen, especially the civil society or groups who have been working, especially with the street children. Those who are smoking or taking drugs, they always keep away these people from the mainstream. So what is important is that unless we involve them, engage them, communication, like making a first initiative of getting into it, because they have a, we think that it is a bad habit and bad people should be away from me. No, it is not a question of it is not the people who need to be away from you. It is the habit or particular behavior which need to be away from you. So it means engagement is the most important thing. How you are going to engage these young people in through sports, Maidan or sports is something which makes you engaging these people first. Involving them in some theater activities, some program need to be evolved around in the community where these people can be involved, where they have a decision making process, where they have been involved in what to do, what not to do, rather than you are teaching them what to do, what not to do. So it means meaningful participation of these people in your program is helpful, which you have been already been trained as a part of your social work education, the group work. So group work is very much needed over there. Uh, Involve these 10, 12 young people in a day-to-day conversation with them. Ask them to evolve some program for themselves and let them decide rather than you decide, because you become a part of as a facilitator rather than a decision maker for as adult. So it has to be a partnership between the both. So once you start not addressing the tobacco immediately, because what happened when we go, we start giving suggestions, we start giving. So I think the best thing is to get communication through, involve them, listen to them, because there is always some underlying issues which is because it is helping them in some way, and how it is helping, we need to understand with a better understanding these people rather than understanding the tobacco, because it is not the tobacco which need to be understood, it is that their behavior which need to be understood. So I think by this way you can approach them, and your principle of non-judgmental attitude will help you to engage and communicate with them, certainly. I hope you found the answer, but still, I'm open. You can give me a call, and you can take telephone.
Is there any other question from any other student, please? We can take
Yes,
one
sir.
more
Thank you so
question.
much, sir.
Yes, you are welcome.
Yeah, Abhishek Kumar.
Yes, Abhishek.
Yes, sir. Very good afternoon, sir.
Good
So,
afternoon.
taking your point forward, is yoga can help the individual to divert from these bad stuffs, these bad habits, and can yoga facilitate in giving some behavioral change in this?
Certainly, engagement and participation, and because what you are going to offer, yoga can be one of the many programs which you can offer. So yoga, sports, anything which is available, which is not resource intense. Yoga is not a resource intense, but it has a time limitation that you might be doing it in the morning or in the afternoon or in the evening, or with some limitation of your food. So with all the limitations, certainly yoga can be one of the many activities which you can organize.
Thank you, sir. Got it.
Sumit sir, it was very nice hearing to you, and a lot of students from MIT Institute of Public Health,
Yes.
they too are associated with you still,
Yes.
and we look forward for more cooperation and collaboration with you.
Sure.
It was nice to see you on the platform. So,
And I think, yeah, correct, because Sunil ji ka I've seen in public health somewhere Mehak, Dr. Mehak earlier has shared
yeah.
something, so you are attached with that. Great.
No, she has like Amity in general, like has been we have been associated with many years,
Correct.
and they have been real collaborators in all sense. Certainly, we will love to see Amity's because now you have a campus in Chandigarh also, because
Yeah.
Chandigarh is another focus area where we can involve Amethi. I met one of your while coming back from Chandigarh, the placement officer or somebody who was. So we were, but we could not able to take it further. If you people can take it further, certainly we will be happy to contribute. Yeah.
Sure, sir.
Thank you so much. And I think your cooperation is definitely further expected as you are giving since many years. And this is the time I think to end, because I know
Yeah.
Sunil ji has joined and is there since beginning, and we have crossed the time limit also as such. So thank you so much. And on behalf of Amity Institute of Social Sciences and Amity Institute of Public Health, because this program is jointly organized, and the director of Dr. Amrish Chandra is already here, and he's welcome the guest. Dr. Nirupa Prakash is not able to join today because she is busy in the International Women's Day program. So she was very much interested, but we can understand the importance of every program. But this program definitely, according to me, achieved the objectives as we have planned, because there was a diversity of speakers, from practicing doctor to government official to NGO practitioner and functionary. So, and especially a social worker NGO functionary. So this is something which is a great combination, and I'm looking forward this session as an outcome where we are in future both the institutions can collaborate and apply for some funded research projects in this area, where students can collaborate and work and learn as per the vision of Honorable Founder President Sir, Chancellor Sir, and Vice Chancellor Ma'am, that Amitians should work in a line of manner where they are doing whatever they are doing great. So on behalf of everyone, I'm thanking all the students. Social work students are on field work, but they have joined from different places. So thank you. And all the students from AI, Amity Institute of Public Health, and the faculty members. So I can see Dr. Sharjina Sahid ji is there from Amity Institute of Public Health, Dr. Bhavna Sharma from Amity Institute of Social Sciences, and many other people, those who have joined today. Thank you so much, and looking forward, and especially the students from journalism and mass communication, MA development studies, work, and public health, and other programs also. So because this is the list which I can see now, but there are other also. So over to let's end this session today with a pledge that we will end this tobacco smoking and every bad habits from the youth together. And thank you so much. Thank you, Sunil ji. Thanks for joining.